When I was a sophomore in high school, I was really anemic, and one day I was getting up to leave a friend's house and I passed out and hit the wooden floor, bounced up and hit again. And my brother-in-law thought I was swallowing my tongue, but when he rolled me over, he saw teeth come up in my throat, so he put his fist down there and took my teeth out. And it was my two front teeth, so it was right before finals too. And that was like the start of everything that continued to go wrong with my mouth. In my late 20s, I started getting periodontal disease. I was having issues with infections in my gums. My teeth would get loose and I'd lose one. I had a lot of dental tools. I had a lot of like filling repair kits and so forth, because if a tooth came loose and something hurt, I'd have to deal with it for 2-3 days before I got to the dentist if it was on a Friday night. And then like other things where we'd go out to eat and, what are you eating today, Nance? Do you have a loose tooth today? It'd be like, okay, so we're at lunch and I'll have breakfast now because I can't bite into a sandwich today. It was things like that that were every day that are really inconvenient. So I was very self-conscious of smiling anymore, at least with a full smile. It was more of just a straight line smile. I didn't high smile anymore. Then it was always, as soon as you were done with one thing, it was starting another procedure in another part of your mouth. So it was just the entire time commitment of constantly going to the dentist.
When Nancy first came to my office, she was excited about the possibilities. And my job in this process as a surgeon is to determine, can her desires, can her needs be met through the surgical or restorative plan that her and Dr. Sullivan had created.
My job as a restorative dentist is I play the general contractor. My job is to help the patient see the vision, help them understand where they want to get to, what the outcome is, and coordinate all the steps and the processes with the oral surgeon, with the dental laboratory, and make it all work.
I just wanted to get to where I just had my mouth completely done once and for all, and I knew it would take a lot of dedication on my part too, because I'm really bad sometimes at following through.
Nancy was not unlike other patients who was concerned about pain. When you consider removing teeth and placing implants, in Nancy's case it was 14 implants. Once we explained to her the process, she felt very comfortable and very excited, and as most of our patients do when we get done with that consultation, they have one question: when can we get started? When can I have my transformation?
So we drove up, and I was still a little anxious about being put under. He did give me something, so I just relaxed first, and then the next thing I knew, I was awake and I had a beautiful set of temporary teeth, and I was going home, and I didn't feel that much pain. I mean, I was numb, or I was out of it from the medicine, but I felt pretty good. I mean, 2 days later, I was painting a house.
Going to sleep, having all of your remaining teeth removed, having implants placed, which are the foundational root structure for the new teeth, placing new teeth, and then waking up with brand new teeth. Problems gone, new teeth are there, and she can go home, have a very comfortable dinner that night with her husband.
Dr. Boyce gave me a mirror. I thought they looked beautiful. I thought, wow, this is pretty easy. I went to sleep and woke up, and it's finally done. It's just done pretty simply. I wasn't in a lot of pain.
The traditional way that one might treat Nancy's case is to place implants, close the gums over the top of them, and then place a denture that she would wear for 4 to 6 months. This is a very painful process because the denture is resting on newly surgerized gum tissue and putting pressure on the wounds. With this revolutionary process that we use, we place the implants, we close the gum tissue, and then the new teeth rest only on the implants. Nothing is touching the gum tissue or the bone that has been modified. And this is one of the reasons why our patients do not experience postoperative discomfort or pain.
Pain has not really been an issue at all with this procedure. By the next morning, I was almost 100%. I felt really good.
Nancy's case actually went quite smoothly. The only setback that we had is we actually lost one implant.
One of my implants became marginal, and Dr. Sullivan called Dr. Boyce, and within an hour, Dr. Boyce came over with an assistant, and they fixed my implant right away, which was good because, like I said, me following through was really bad. If they would have said, you need to call Dr. Boyce, make an appointment so he can check this out, I probably would have waited a month. That's just the type of person I am, because I'd be afraid of having it done again. It was done within like 40 minutes.
What makes Dr. Boyce and myself, what makes our relationship unique, is that we've developed a synergy in our thinking and our process, that how we manage patients, the experience that we both believe that the patient should have, both from the treatment they receive and the way they're treated.
The teamwork is most important. The patients already come with fears and concerns, and they're worried that as they go from one office to the next, that things are going to be dropped or things aren't going to be communicated. When you have the correct team in place, with a restorative dentist, with a laboratory, with a surgeon, things don't get missed. It's like the patient is being treated in one office with one team.
Everything we do is based around the aesthetic outcome, and then the function and the form just follows naturally into that equation. And so I certainly will put the teeth where I think clinically and aesthetically they look best, but we always get the patient's input, and also involve the dental laboratory in the process quite extensively through photographs, through interviews.
As I was getting my permanent teeth, for the first time ever, I actually met the person from the lab. I love the color. I think it's perfect. I think they look natural. I get a lot of compliments on them. Joe thinks my teeth make me look like 10 years younger. He thinks they're great.
We know this procedure. We know this process. It's a great experience to be involved in it, and in Nancy's case, we nailed it.
Probably one of the most rewarding aspects of this process, and specifically with Nancy, is to see her come out of surgery and to see a transformation that just took place, and know that her life is forever changed in a positive way. And to know that you took part in that and you just nailed it, it's a great feeling that it's hard to describe. It's awesome to be part of that experience. It's literally a gift that I feel honored that I get to give to another human being.